Pallabi leads the thank you. Leads the DigiSwasthya Foundation, a nonprofit organization which works on providing accessible and affordable healthcare in rural India through digital telemedicine centers. She is passionate about social entrepreneurship, health tech, healthcare awareness, and you can reach out to her at, she shared her link tree for a discussion around such themes. So I'm just going to drop that in the chat once more. And without further ado, Dr. Pallabi, go ahead. The session is yours.
All right. Thank you so much. But I think before I begin, I'd just like to interact with all of you. So where are you all connecting from? I can see some comments in the chat, but what about the rest of you? Okay, I see that it's a lot of mixed geographies. Okay, great. All right, amazing. Are you allowed to unmute yourselves and interact? Would that be possible? Okay, awesome. If you can, then please go ahead. I would love to hear your voices. Okay, so I see that some of you are in school. Is there anybody over here who is in college, completing their bachelor's? Okay.
I'm in 10th grade in high school.
All right. Okay, all right. Thank you, Ryan. What about the others? 9th grade. Okay.
I'm also in 10th grade, but in the UK, and that's year 11.
Mm-hmm. All right, thanks, buddy. Okay, so a lot of 9th and 10th graders. Okay.
I'm in my 12th grade.
Okay, 12th grade. Awesome. Oh, somebody's doing their MS in health psychology. Wow, that's very interesting. So let me start with the basics then, since you're all in the, we have, okay, who's the youngest person here? 8th grade? Is that the youngest? Yes, okay, great. You think, all right. Yeah, we'll wait for everybody else to participate as well so that I understand from where to begin, because, building blocks in these kind of concepts is important, but because you all belong to a generation where we are more aware about what's happening around us, all the technological advancements, and because you have lived through the pandemic, the COVID-19 pandemic, I'm sure most of you are aware about telemedicine. Have you heard of telemedicine before? Yes, okay. Simple, even if you don't want to unmute yourselves, you can just use the reaction button, give me a thumbs up or anything. You can raise your hands if you want to talk. Okay, hi. We have somebody from Nigeria. Okay. No, okay. So Sharanya says that she hasn't heard of telemedicine. What about the others? Okay, all right. Okay, somebody says that they have. Suprita, would you like to share what you understand from the term telemedicine, or what you have heard of it? I'm not looking for anything that's like right or wrong or the textbook definition or anything of that sort. I just want to understand how much you know what you're aware of. So it's fine even if you are right or wrong. I mean, telemedicine is a subject that's evolving. Yeah, okay. Use of electronic information support healthcare. Okay, fair enough. Anybody else with a different understanding? So
could I
distribution? Yes, go ahead.
Could I just ask a question? So I know my parents, like they're both GPs and they do a lot of telephone triages. Would that include telemedicine?
Yes, yes, that does. That does actually.
Okay, cool.
Okay, great to know, Gauri, that both of your parents are GPs. And I think this as a concept would be interesting for them as well. So if they're around, pull them in and add them to this Zoom call. I'm sure that they would want to know more about this. Yes, exactly. So, okay, Famida, you have a question? You want to say something? Go ahead.
I think telemedicine is like using electronic means, let's say phones or devices, to help aid, let's say, appointment between a patient and the doctor, or like more interactions that don't require physical meetings or any other thing. Let's say the person has a communicable disease or something like that. Telemedicine is useful in a case like that. That's what I think.
That's right. And Supreeta also says long distance patient doctor relation. Absolutely. So, all of these things, whatever you said so far, is correct. Let me break it down for you. So, the term telemedicine is made up of two components, tele and medicine. What does tele mean? You all heard of telephones, right? Telecommunication and medicine. You all are aware about what medicine is. So we are trying to make healthcare more accessible using telemedicine. Like people, the other participants in the call very rightly said that you're using technology. How are we combining technology with healthcare to ensure that the healthcare needs of the people are fulfilled? So, how many of you have ever, maybe called up a doctor, spoken to them over a phone call, or maybe dropped them a message on an instant messaging app, let's say like WhatsApp or iMessage, or ask them something about a problem that you had over Facebook? Have any of you done that? Ever messaged a doctor? Yes, Famila, go ahead.
Well, my family has a family doctor, so like we don't always have to go there every time to talk to him. We call him over the phone if any of us has a problem, and just gives us the right prescription. We don't always have to go to the hospital.
Right. Okay. Abhinav, what about you? So you're saying yes, family doctor. Was it a message or a video call or an audio call? What was the form of communication that you had with your family doctor? Anybody else? Have you ever called up a clinic to ask if the doctor would be available, or tried to book an appointment with the doctor over a phone call or through messages? Okay, you messaged and you discussed about the issue. Thanks, Abhinav. Okay, Kavita also says yes. Great. So we've all done this before, right? We have interacted with the concept called telemedicine. It's just that we weren't aware that it's called that. But now you know, now you're aware. Anytime you're using any electronic means to receive a healthcare service, that is telemedicine for you, right? So now can people tell me if they have some idea about what telemedicine is? A show of hands is fine. Yeah, okay, great. So now you understand what telemedicine is. Okay, I'm glad. Okay, so I think Fami, that you mentioned that you don't have to go to the doctor, visit them in person, right? Also, if I'm pronouncing your names wrong, please correct me so that I get your names right. I don't want to be pronouncing it incorrectly, because that happens a lot to me, so I know how it feels. So just feel free to correct me, yeah? Yeah, Famida, you were sharing about how you don't have to go in person, right? Do you feel that that has some benefits? Do you think there are some benefits of telemedicine? Anything that you can think of? And this question is really, yes, go ahead.
I think it's actually better and more time saving, because like our family, even though it's our family hospital, is like quite far from where we live. So instead of us having to drive all the way down there every time, it's just like easier to talk to the doctor over the phone. So it saves time and it's more effective.
Wonderful. Yeah, you just listed, some of the major benefits of what telemedicine is, what it does. Okay, people have raised their hands. Yes. Suprita, go ahead. You want to share what you think how that telemedicine can be helpful?
I think one advantage about this telemedicine is it has facilitated the patient monitoring through computer or tablet or any electronic devices or to phone technology. It has reduced the outpatient visits. So this is an
Yes,
advantage to it.
that's right. Using computers or telephones or tablets, a lot can be achieved, right? Abhinav, yes, go ahead. You're next.
Hello, am I audible?
Yes, you're audible.
I guess it has been really helpful during the COVID.
Right. So Abhinav, your voice was breaking a little
We were
bit, but I heard that.
allowed to go out, so we had to use what means we had with ourselves, like phone, the video calls and all. So I think it has very
Okay, so I think Abhinav has poor connectivity, but I understood what he was trying to say. He mentioned that it was used during COVID, very pertinent. That is what led to the rise of telemedicine. Health tech saw a boom in 2020, and this happened after the COVID-19 pandemic started. So thank you, Abhinav, for raising that point. Gauri, you want to add something to this?
Yeah, I was gonna say pretty much what Abhinav said, but I think there are also other advantages, like people who have lower accessibility, like disabled people. It's perhaps often more convenient for them to have like a triage or like a video call instead. And I think it's also maybe this is far stretching, but it can just reduce the amount of hospital equipment that's used for someone that doesn't really need it and can have their problem solved over like a video call or phone.
No, God, you're absolutely right. It's actually not too far-fetched to say that this is what happens. It actually does happen. So in practice, when you have a satellite center, which is located more in, how should I put it? When you have a center that is more local than something that's at a distance, like a tertiary care hospital, it is easier for the medical practitioners and the entire ecosystem to take care of the burden, right? So because you're already filtering out the cases which are less severe at the local level, and then you're only sending the chronic cases or the severe cases to the tertiary care hospital. Like you said, that leads to things like reduced equipment, more, an increase in the ratio between how many doctors are required for what kind of population. So I'll discuss all of that. Yes, Abhinav, your point was clear. I did discuss, COVID-19 and how telemedicine is linked to that. Sharon says that it reduces time and in some really serious cases proves really effective and efficient. Absolutely. So I think this is a common theme that we have seen among the answers that we received from you guys, that it saves time, it's effective, it's efficient, it reduces the load on the larger ecosystem, and of course it leads to a decrease in things like nosocomial infection. Does anybody know what a nosocomial infection is? I will spell it out in the chat for you guys so that you can look it up in case. Yeah. So a nosocomial infection is something that is acquired while you're in the hospital. During the pandemic, again, we saw some cases where people went to the hospital for, let's say, a fractured leg, or they went for something like a surgery. Yes, exactly, Suprita. So, but later, when their tests were done, they found out that the patient also had COVID. How do you think that happened? Any guesses? Somebody who went to the hospital. Yes, yes, Malika, you're right. Exactly, transmission. So hospital acquired infections, like Suprita said, HAI, or infections that are transmitted to you because of the other patients around you. Now, through telemedicine, we're also decreasing that. We're decreasing the such incidences where a patient transmits the infection to another patient. And it's not fair to blame the patients who have the infection or the medical personnel there. You see, something like COVID, which is so contagious, it's very hard to restrict it. It's very hard to be careful and follow all the protocol and ensure that you don't get infected, right? How many of you suffered from COVID in the first or the second wave, or how many other waves your country has seen? Anyone here who was infected with COVID-19? Okay, I see one hand go up. Thanks, Emma, for answering. Okay, Gauri also had it. So I hope you guys are fine now and you have recovered. Yeah. And
Yeah.
unfortunately, a lot of lives were also lost due to the pandemic. Now, recovered thankfully. Okay, that's great. Good to hear that. Could lives have been saved had we practiced telemedicine more than we did? During that time, yes, there were a lot of doctors who moved to telemedicine, but in my opinion, I think it was a little too late, right? We tend to do things when there is a need for it. What's that quote about necessity being the mother of inventions? Yeah. So we started adopting telemedicine only when there was a dire need for it. There was no other way around it. Because before this, doctors had the impression that patients won't be satisfied by the kind of service that you provide online. For those of you who've had a virtual consultation, how many of you were satisfied with what the doctor said? Like, I think Abhinav and Famida, both of you mentioned that you visited the family doctor virtually, right? You connected with them, they gave you a prescription. Were you happy with that? Were you satisfied with the treatment or with the results that you received? Yes, Abhinav says he was. Okay. Okay, Famida also agrees that she was. Right. So at DigiSwasthya, we are trying to provide, okay, Najla says she's not, I'm sorry if I am pronouncing your name wrong, but okay, not happy. Can you tell me why? What was missing? What did you think could have been better? Najla, can you hear us? You can unmute yourself and let me know. Yeah, Najla said that, no, I am not happy. So I'm asking that what could have been better? Anybody else who thinks that telemedicine does not provide you with the same experience as what you would have if you visited the doctor in person? Correct. Okay, Najla says when we get medicine from the doctor. And Suprita says that telemedicine also has disadvantages. Absolutely. Network is not perfect all the time. That's right. Abhinav says that there is a graver issue that not everybody has access to it. Everybody does not have mobile phones or internet connectivity. Perfectly. I mean, this is, Emma says that I think doctors do not have full access to technological awareness. Absolutely. You guys are so aware. I'm in awe of how well informed you are. You know, miscommunication. Agreed. Yeah. In-person observation is better. That's right. Correct. Absolutely. So there are some downfalls. There are some things that it may pose a threat. Confidentiality of data. Correct. Exactly. A lot of doctors are not aware about what telehealth is and they're reluctant to use it. Malvika says if the treatment requires physical tests, then that would be difficult. Yeah, I think you all have covered most of the points. The doctor might not be able to examine the patients that needs physical contact. A doctor can't carry all the necessary equipment. Difficult for senior doctors to adapt. Wonderful. So, does anybody have solutions as to how we can maybe overcome these challenges? What can be done to overcome these challenges that come along with the use of telemedicine? Emma says hybrid mode. Amazing. Yes, absolutely. That's right. Anybody else? More suggestions? More solutions?
Hello.
Yes, Abhinav.
Yes, I guess we can like it's part on the government, like we can have a common helpline number as to where the the patients can call and ask whoever is on the other line about their issue. So have a common helpline.
Okay, yeah, that's good. Have a common helpline number which is reachable. Everybody can reach out to that number. Suprita says awareness. Yes, Rishmita also says the same thing. Awareness should be spread about the technology.
Hello.
Agreed. Yes, go ahead, Famida.
I think by bridging the digital divide between the privileged and less privileged, but I'm not sure if that can be an individual help. But if, let's say, the government or the rulers in the country can start with it step by step in trying to bridge the digital divide between the privileged and less privileged, so everyone has access to what they need to benefit from telemedicine.
Yeah. So that is something that again becomes a barrier. The socio-economic status of a person, how privileged they are. Abhinav says trainings for doctors about the usage. That's right. A traveling doctor. Yeah. Malvika says that something like a van. Yes. Sharina says we should use some kind of an app which does not use internet and data and can work without internet. Matthew, I must say that this cohort of students is brilliant. And I see so many of them becoming innovators because they have the right ideas.
Yeah, thank you. This is our community of next generation leaders.
Yes, I can see that. Because a leader does not just come up with the problems, they also come up with the solutions. And I can see them doing that. That's wonderful. I'm so happy to see so much of brainstorming. And let me tell you that telemedicine right now does need these kind of ideas. A lot of people who aren't doing these things. Okay, Viola says maybe creating a specific telephone for emergency. Yes, we can do that. Doctors should build a strong online presence. Yes. We need to remember that we don't exploit the resources provided by the doctors. Agree? Agree. Now I'm going to ask you all to just give me maybe 2 minutes and allow me to share about what DigiSwasthya does. Yeah. And maybe once you've heard about it, you can also help me understand how to make it better, because I see that you have a lot of ideas. There are a lot of things that we can implement. And I would really need your help to strengthen what my organization does. So is it okay if I share a deck, if I share a presentation, or is that a little boring for you guys? I would like you to see some images just so that you can correlate. Yeah? Okay, I'll go ahead.
Okay, you may.
Okay, thank you so much. Is my screen visible?
Yes, it is.
Yes. Okay,
Yes.
great. All right. So as you can see, DigiSwasthya has 4 words written beneath that: awareness, accessibility, affordability, and aid. A lot of you mentioned that awareness would be a good stepping stone. It would be a good starting point. Accessibility. What do we do about people who don't have access to digital devices, who don't have mobile phones or laptops or internet connectivity? Affordability. Somebody mentioned something about privilege. Yes. And of course, aid. So DigiSwasthya is a nonprofit organization. It's registered as a Section 8 organization in India. And it was started by Mr. Sandeep Kumar, who is a childhood cancer survivor. Now, his story is something that has inspired all of us to come together and work on DigiSwasthya. He was about 12 or 13. So maybe some of you guys must be 13, I believe. When he was diagnosed with cancer. However, it took 6 months for him to get the proper diagnosis. Now, imagine something like cancer, which is known to be fatal, right? People get scared often at just the mention of cancer. But for Sandeep and his family, it was a very challenging period. And after that, he worked at some healthcare institutions. And he decided that nobody should have to face the same challenges as he did. So in his village, he set up the first DigiSwasthya Telemedicine Center. And this center is a hybrid medical consultation facility. So somebody mentioned a hybrid model, right? And what is this hybrid model like? It's a combination of physical as well as digital. Now, these are some of the problems that we are tackling and some of the problems that you all mentioned. In India, in the villages, there is a lack of doctors. There is a lack of qualified doctors. Have any of you ever faced that? Maybe in your countries, maybe in the more remote regions, have you faced a lack of qualified doctors? Okay. All right. I can see
Oh,
your response.
yes.
Yeah. So toe pining, where are you connecting from?
Hello. Am I audible?
Yes, you're audible.
Okay. I'm coming from Myanmar, Yangon.
Okay, all right. And
So-
you say that you face this issue where there is a lack of doctors, right?
Well, when I was younger, yes, but
Yes.
now they're more good private, more accessible hospitals. So there is more access to quality healthcare now. But yeah, and when I was younger, like there was a lack of qualified doctors.
Yeah. And even now, there are places all over the world where there is a lack of doctors, there is a lack of qualified medical practitioners, there's a lack of facilities. And even at places where you do have the facilities, the treatment, the quality of treatment is inferior. So because all of you are, of that mindset where you want to be leaders or you're already leaders, right? Data is something that's always going to help you. And there is a data point that I want to quote, which says that it's a study by the Lancet, which says that more people in India died due to the inferior quality of care rather than the lack of access. Yeah. If you need me to repeat something, I can do that. In Afghanistan, okay, Najla says in Afghanistan, we faced lack of doctors and facilities. Yeah. People in rural areas use herbs instead of proper medicines. Exactly, absolutely. So these doctors or so-called doctors, they're called quacks. okay? In India's, in the rural villages, they're called quacks. Yes, governments fail to understand how important it is to invest in healthcare. Now, there is an amount of, there is a component of the budget that's dedicated to healthcare, but it is not enough. And a lot of times, more than the allocation of the budget, it's more to do with the utilization of resources. Yeah. So even if, let's say, there is just an example, okay, just an arbitrary example. If I say that, okay, $1 million are allocated for healthcare in XYZ village, but it's not necessary that the government of that village would utilize those funds and invest that in healthcare. They might just invest $20,000 from that 1 million that they had. So again, that is more to do with the utilization of resources and allocation of the budget. Now, like you mentioned that, some of you mentioned that, yes, it's common in Indian villages where people just use herbs or other traditional means to recover from serious, okay, grave diseases, grave disorders like cancer, for example. And this leads to worsening of the condition, right? So by the time the patient receives the care that they need, it is too late. And that's why we're trying to, yeah, here you can see in the objective, we're trying to go for early diagnosis and prevention of diseases. Now, if cancer in its nascent stages, or any chronic illness for that matter, in its nascent stage, in the initial stages, is detected, we can control it. And even if it is something that can't be controlled, we can provide the patient with palliative care. How many of you know what palliative care is? Have you heard of it? I'm going to type it down in the chat box. Yes.
Yes.
Okay. Yes, you all are aware of it. Great. Okay, yeah. So for those of you who aren't aware of what palliative care is, it is something that you do just to relieve the symptoms of the disease, because you cannot fix or cure the root cause of the disease. You just try to alleviate the symptoms so that the patient has a better life. This could be anything from making their sleep cycle better or their diet better. Yeah. And it is mostly associated with, yes, it's not curative, it's palliative. Correct. Things like insomnia, you can make those things better. And you can make the life of the patient better for whatever period they have. Like sometimes you'll hear cancer patients say something like, doctors tell cancer patients that, oh, you just have maybe about 2 years of survival. Now, how do we make those 2 years better for them? How do we ensure that they're not in pain? That is something that is done through palliative care. Now, concepts like these are not common in villages or remote areas. And how do we make it more prevalent? How do we inform people that something like this exists? They don't have to suffer in pain. We do that through awareness. Yeah. Now, this is a study that shows how much time and money a patient saves if they visit the local DigiSwasthya center versus if to have to travel to a nearby city called Gorakhpur. This is for a place called Uttar Pradesh. I see some raised hands. Go ahead. I think Famida and Sharanya, both of you had something to share. Maybe we'll start with Famida. Okay, Sharanya, do you want to share something? Okay, no, all right.
Okay, I wanted to talk about the palliative care.
Yeah, go ahead. If you guys have anything that you want to add on,
okay.
You can just put in the chat.
After the advent of the COVID-19 pandemic, the government gave palliative care to most of the families of the affected people and to most communities that that weren't really privileged. Most of the slums in Nigeria, the government really helped them with palliative care, but then everything turned all around when the NSAS started. But then the government helped a lot with those palliative care. It gave out foodstuff, healthcare facilities, and other things.
Yeah. So, similarly over here as well, like you said, that the slums in Nigeria, sometimes they can't afford the care. Sometimes patients can't afford to get surgeries done. They can't afford to get operated upon. And in those cases as well, we offer palliative care. Yes, Sharanya, you wanted to say something?
Mom, sometimes many people they cannot afford the proper healthcare, so the patient has to suffer the entire time because those people who cannot afford, they just tell him or her that you live a life until God wills. So now if we cannot afford it, then why extend life when you have to die sometimes anyway?
Yes. That is a very realistic scenario that a lot of times families have to face, doctors have to face, and you have to make that difficult decision. You have to see if you're able to afford the treatment or not. I think, Rishmita, you wanted to add on?
During the beginning of the COVID time,
Rishmita, could you please, can you maybe be a little bit louder? I'm sorry, I can't hear you.
Hello, am I audible now?
Yes, you're audible.
So I was saying at the beginning of the COVID-19 pandemic, we were exposed to the vaccines for the first few months and the first 1 year. But then
I'm sorry, I lost you after you said, I think, COVID-19. Maybe if you could just bring the mic closer to your...
Yeah, now.
Yes, it's better now.
So like at the start of the COVID-19 pandemic, we did not have vaccines. So that time we used palliative care. Like when we had fever, we used to be
Yeah, so when COVID-19 started, people weren't sure about how to treat it. Can palliative care be spiritual too? Yes, of course. So a lot of people turn to religion and spirituality when they are faced with such conditions. They turn to that, and it can be anything that makes you feel better, anything that makes your life easier. You see a lot of institutions that offer palliative care, in-house care. They do have some sort of religious center or a spiritual center where you can practice whatever religion or whatever your faith is, and feel closer to the universe, to God, the higher power. And coming back to what Rishmita said, yes, so during COVID-19, initially we did not know how to treat the infection or how to stop it from spreading. And that is also when doctors started off with something like palliative treatment. They said that, okay, fine, it's cough and cold, we are going to focus on that. So they didn't know what the root cause was, but they just focused on the symptoms at that time. Now, these are some of the doctors that we have on board, and we are very grateful to them because they have taken out the precious time from their schedules to see our patients, to take care of them. And this is how we're changing primary healthcare in India, through telemedicine centers for marginalized communities, through awareness in local languages. Now, EMR, does anybody know what an EMR is? No? Okay. Anybody wants to give it a shot? All right. In the interest of time, I'm just going to... Okay, Rishmita, yeah, go ahead. Emergency. Okay, no, it's not emergency. So EMR stands for Electronic Medical Records. Yeah. So like somebody mentioned something about data privacy confidentiality being the cons of telemedicine, that people are concerned about their data being leaked. Now, with an electronic medical record, what happens is that you have access to your records from anywhere in the world, and you can share it with whoever you want. So let's say today I'm in India and tomorrow I move to Canada. I would still have my records with me. So my doctor in Canada will have access to my records which were created in India. Why? Because it's electronic. So I'm sure most of you use Excel, right? Excel, Google Sheets. Similarly, some of the data points can be noted down. Things like my name, age, my sex, my occupation, where I'm from, what kind of diseases I have or have had in the past. Yes, it is also called EHR, Electronic Hospital Record. That's right. Now, in the villages, what happens is that people don't have the knowledge about what has happened in the past. They don't know about their medical history. They don't know what they're suffering from, what kind of drugs they're on. Viola says that this is a great idea, even more for migrants and refugees. Absolutely. You know, even if you have to move from one place to another due to conflict or something like that, you won't entirely lose all your documentation because everything is there, safe and secure on a cloud platform. And I'll come more to the data privacy and security in a while. Now, we also have referral network with hospitals. Like I mentioned that our telemedicine centers, they act as satellites. So we are filtering out the more, the less severe cases at our level, and then referring the chronic cases or the more serious cases to tertiary care hospitals. Now there's primary healthcare, secondary healthcare, and tertiary healthcare. Okay, these are the three different segments. And primary healthcare is to do with more on a basic, on a community level, on a village level. Then you have your community healthcare centers, or CHCs, they are called, and that is for secondary healthcare. Tertiary healthcare, you have the bigger hospitals in tier 1 cities. Yeah. Anybody has any questions or any comments to add on? You can just type it in the chat. Now, these are the 5 phygital telemedicine centers that we have so far in India. And you can see that some of them are in villages of India where the need is dire. And what is the purpose of having a hybrid model? Now, like you said, that a lot of people don't have internet connectivity. They don't have access to a computer, a laptop, a mobile phone. So for those people, they can come to our center. They don't need to possess any of those things because the center has it. Yeah, that is a local node of primary healthcare where you can have access to all that you need for a teleconsultation. And this is how it works. The patient visits the center, and we have a team member called a patient navigator. Now, this patient navigator does not have to be a doctor. They can just be an ordinary person from the community doing extraordinary work. Yeah. So the patient navigator comes in and they measure the vital signs of the patient. What are the vital signs? Things like your temperature, height, weight, glucose levels, oxygen levels. So oxygen saturation levels, that was something that was important during. What do you need it for? Yes, for COVID-19. Yeah. And then the patient navigator, after measuring all these vital signs, connects the patient to the doctor using a telemedicine software. And then the patient and the doctor have a video call the way you and I are having a video call right now. Yeah. And then all of this data is stored as an electronic medical record and uploaded to the cloud. And this is a safe and secure platform where, because our patients belong more to the villages and they're not tech savvy, our patient navigators make them sign a consent form, which allows the patient navigator to have information related to the patient's records. So they can represent the patient. And in this way, it also reduces the communication barrier. a lot of times, you must have heard that doctors' handwritings are just scribbles. People don't understand what the doctor has written. Yeah. How many of you have faced that? You have, okay. Yeah. Okay. So many of you. Yeah, it's a very common problem. The doctor writes something and you don't understand what it is, and you don't know how to consume those medicines. What do? You can't always be going to the pharmacist to ask, right? And more so in the villages. So that's why we have a patient navigator who does the translation. Okay, Rishwita says every single time. Yes. But I can assure you my handwriting is not that bad. So if you ever...
I heard doctors deliberately do that so the patient won't be too scared about what they're writing.
Yeah, so that's why, electronic medical records, another reason why they're good, because everything is typed out. Nothing is handwritten apart from the digital signature of the doctor. So it's very, very easy for you to tell that, okay, this is the medicine that I need to take for these many times, for these many days. Yeah. And then the patient navigator tells the patient about, okay, this is what the doctor has advised. And after that, they also tell the patient what to do next. What is the next step? Do they have to go to a pharmacy? Do they have to go to a lab? Do they have to go to a hospital? When do they need to come back for a follow-up? Follow-ups are very important, So when the doctor tells you that, okay, have this antibiotic for 5 days and then come back to me, you're supposed to come back to the doctor because they need to check whether your condition has improved or not. Okay, yes, Rishmita, go ahead. You want to say something? Rishmita or Kavita? Please go ahead.
Ma'am, I think the difference in the handwriting is leaded mainly because of the urgency of the doctors, because they have many other patients to look after, and every patient, every individual health is just as important as any others. So as much as the time is taken to optimize the problems of the patients, I think the change in the writing, as many of all of them suggested, could be because of the because of the urgency that doctors want to optimize you the best, and also other individuals who are waiting, and they also need to be optimized the best in the as quickly as possible.
Right. Thank you so much, Kavita, for empathizing with the doctors. You are absolutely right. Even they're in a hurry, and they need to be done with the patients as fast as possible because there's so many more people waiting. Yeah, Sharanya, go ahead.
A doctor's handwriting is even more confusing than one of those confusing Shakespeare plays.
Yeah, I love that analogy.
And that's why in our class, whenever a child scribbles something in our exam paper, our teacher always says, "You'll grow up to be a doctor one day."
Well, I don't see that as being a bad thing. You should be proud of yourselves. Yeah, no, but in all honesty, if you look at the WHO ratio, there is an ideal ratio that's provided that you need these many doctors for these many people. And that has to be followed in every country so that we're able to provide quality care to the patients. Yeah, as the population increases, it's very important for the number of registered medical practitioners also to increase. We need more qualified doctors. We need people who can actually help and make a contribution to the society. And being a healthcare professional is not the only way in which you can do that. Like I mentioned that, the patient navigators, they're just people from the community who want to help. So there's a lot of local community engagement. There's a lot of youth engagement. There are people like you and I who just want to make a difference. Yeah. And like I said, that because they're from the villages, they're from the community, it's easier for them to communicate and connect with their own people. The villagers, they are reluctant, right? So it's easier for the villagers to see something and believe in it. They think that, okay, fine, if somebody from my village is advocating for this, it must be right. And for that, we also have a good number of results. like I said, that you have to be very data driven. And this is what the data says. We've completed 6,000 plus consultations so far, all of them teleconsultations. And this was for people who are from marginalized communities, who are from villages, who didn't have access to, let's say, an in-person doctor, or just thought that it would be easier to visit DigiSwasthya than to go to some other healthcare facility. Yes, and this is from 2020 to 2022, 20th July. That's when our operation started. And this data is till 30th of March. I'm sure that this month as well, if you go look up our social media channels, you will be able to see we keep updating our numbers every week, so that it is transparent even for the people who are helping us. Wow, thank you so much for the compliments. And what about the doctors? We have 100 plus healthcare professionals on board. That includes GPs, includes specialists like oncologists, dermatologists. We also have mental health care professionals. We have dietitians, nutritionists, physiotherapists. So it is a wide range of healthcare professionals that we have on board with us, and they belong to esteemed institutions of India. They have their own practices. They are taking out the precious time trying to help us. And they also, so let's say, I'm going to put this in rupees because I don't know how it would translate to dollars. So bear with me, but the numbers should be the same. If somebody can help me convert, that would be great. So some of these doctors charge 2,000 rupees at the hospital, but for our patients, they complete the consultation by charging just 50 rupees. So you can see that there is a stark difference. Yeah. And we've partnered with diagnostic centers and pharmacies. So for people who said that, what about lab tests? A lot of times examination is better when it's in person. Yes, absolutely. That's why we've partnered with these labs or pharmacies so that our patients get a discount when they buy the drugs that they need, or when they go to get the lab tests done. So, patient might have 50 rupees to pay for the consultation, but they might not have 100 rupees to pay for the test. That's why we make it more subsidized for them. Okay, so Preeta says 2,000 is $26. Thank you. Whatever currency you guys understand best. I don't know, because it's a mixed cohort, so I just put it in rupees, but I'm sure you can understand the difference in any case. And from, yes, 250. Oh yeah, 0.65. Thank you so much for converting it for me. Yeah, and this is how we can collaborate. We usually ask our collaborators to help us strengthen our operations, create an ecosystem. So like right now, Matthew and I have connected through another ecosystem called Vruksh, and this was during Misfits. And so over there, actually, I do have a mention of Misfits later on in the deck as well. But yeah, so Matthew and I connected, and I thought that this would be a great opportunity to teach people about what telemedicine is, to not just educate them, but also to understand from you guys what you think of telemedicine, to understand what kind of solutions you all have. Yeah. And because DigiSwasthya is run on donations, these are the different ways in which people can sponsor either patients, or they can help us run a center. This is a financial model for those of you who are interested in the more businessy aspect of it, because it is a social enterprise, right? At the end of the day, we have to ensure that our operations are running so that we're able to serve more people. These are some of our partners, some of our donors that we have on board. These are some of the awareness campaigns. You can see that our patient navigators, the people in white, they go around from door to door, spreading awareness, telling people about what telemedicine is, telling them about how they can avail teleconsultations through DigiSwasthya. We also have webinars, which are uploaded to our YouTube channel. So if in case anybody wants to go and have a look at it. I know that this slide might be a little upsetting, a little disturbing, but this is the harsh reality. These are the kind of cases, these are the kind of people who need help. And a lot of times people ask me to remove it from the deck because it's very disturbing, but there is no point in hiding what the truth is. So I think it's important for all of us to be aware of the kind of conditions that people have to face and how we can be more empathetic and help them go through that, help them resolve their problems. This is the COVID-19 impact report, the kind of work that we did during the second wave. Thank you so much. And that's me in the center. And besides me, you can see Mr. Sandeep. I mentioned earlier about his story, and that's Mr. Santosh. He is also a fellow director. This is one of the success stories. Yes, Simran, you're right. It's reality, and we should have a glance over it. Yeah. So over here, you can see that this particular patient, they went around from doctor to doctor, spending so much of money, so much of time. And when they visited DigiSwasthya, we were able to help him within 20 minutes. And the expenditure was 200 rupees. This is another patient named Mr. Ganesh. And you can see that he had spent less than 2,000 rupees and the center was just 5 minutes from his home. These are some of the awards and achievements that we have. Like I mentioned, the Misfits pitch event through which I met Matthew. These are some of the media coverage, news items, FM mentions, and yeah, that's about it. So I'm going to stop sharing my screen, and in case anybody wants to share the comments, thoughts, I see a lot of wonderful comments coming in. Thank you so much.
I have a question.
Yes, go ahead, Famke.
Does the DigiSwasthya Foundation accept interns and not really like physical interns? Can someone intern online?
Yes, you can. We do have volunteers, and in fact, most of our volunteer strength is made up of remote interns. So we have a lot of interns working for us remotely, and most of them are engaged with our social media. However, I would like to spread it across some more verticals, like either fundraising. We also have some interns for strategy. Yes, you can volunteer. You can definitely volunteer, and I'm just going to put in my email ID here, and not sure if you guys use WhatsApp, but I will also add my WhatsApp number here in the chat. Feel free to drop me a message. If you have any questions, even now, I'm happy to answer them, but I think, I'm not sure, Matthew, I think there is another session scheduled, right? I believe you need to get ready for that. So.
Oh no, it's fine. This is actually the only session for today. So I think
Okay, all right.
if you have the time, we can probably take 1 or 2 questions, and we can close up.
Yes, definitely. You can also reach out to me on social media, Instagram, Facebook, all of it. I would prefer Instagram. I'm so glad that you had a great time. Wow, you aspire to be a doctor. So I think you must volunteer with us to get an insight into the kind of cases that we have and how you can help. Yes, Emma, you want to share something? I see that you've got your hand raised. Yeah. Go ahead.
Thank you so much first for everything that you are doing as a doctor, and I just love it when I see people who I look up to and that inspire me in my work. Thank you so much for that. I have a question. So I think that most of the patients that come into your clinic and maybe cannot afford medications, they need prescriptions. They have these prescriptions, but they do not have the medication associated with it. So how can you afford giving them these medications?
Right. Like I mentioned that, we have a lot of follow-up calls where we call up the patient and we try to understand whether they are taking the medicine or not, whether it's helping them, if they need a second opinion, or if something else has popped up in the past 1 week since they met the doctor. Unfortunately, the response that we get mostly from, this is from just one of the centers where, the socioeconomic standards are quite poor. They're quite challenged when it comes to the financial levels, and it's a quite poverty-stricken area. For those of you who are aware about the Indian geography, this is a rural district in Bihar. It's called Sahibganj, Muzaffarpur, and yeah, so over there, the response is such that the patients aren't able to afford the medicines, and they ask us to help them with that. Okay, you know about this area. Yeah, that's great. Now, DigiSwasthya does not directly provide medication because we don't have the license to do that. However, we partner with other organizations that can distribute medicines, and we can help them find aid for it. We can raise funds for them in collaboration with other organizations, but we cannot directly give them the medicine that they need. For that, they would have to find other sources. Now, we can help them connect with the other sources, but like I mentioned, that there is no direct aid provided for that. So there are other organizations that work on gathering medications, unused medications that haven't expired. And yes, that haven't expired, and they have distribution drives. So even the government has this facility where they provide generic medicines. Do you guys know about generic medicines? They are cheaper than medicines which are branded, and yeah, and they're available, they're accessible in these areas. So they have primary healthcare centers where you can get access to these medications. So we encourage the patients to go there and get the medicines from there, but that is a challenge that we are facing. So I'm glad you brought that up, Emma.
Thank you
Something
so much.
else that you want to add on?
Yeah, I have a question actually. Now there's the new technology and it's very booming these days, VR. So do you think about maybe just in the near future as a vision to incorporate VR within the primary care services provided?
So, that actually is very interesting to me because, like I said, I'm enthusiastic about health tech. And I have been reading up a lot about AI and ML in health tech, but VR2 is it isn't being used as of now, but there are people who are experimenting with it. So, there is a newsletter, I'm forgetting the name, but I will link you to it. You can just drop me an email and just remind me, I'll link you to that. It's very interesting to note how VR is being used to gamify health. People are trying to build apps to make healthcare more exciting. And how do they do that? By gamifying the process. So in such cases, yes, VR is being used. VR is also being used for training purposes. So, like the previous two batches in med schools, they didn't have access to patients, yeah, because of the pandemic. They weren't able to practice on live patients. So instead, some of them turned towards VR and turned towards, practicing on mannequins or things like that instead of live models. So I think, yes, VR is being interestingly used in these cases, but I don't really see it being used right now in telemedicine. That hasn't happened yet. Maybe, you could be the one to pioneer that. So if you have any ideas around that, that would be lovely to discuss. Even if we don't implement something, we can always talk about it.
Definitely. Thank you so much for this.
Okay. Thank you so much, Emma.
Okay, Dr. Roy, I think now would be an appropriate time to close.
Yes.
All right, for sure. Okay, sorry, please go ahead if you've got any closing comments.
No, I think it was a wonderful, wonderful interaction with you all. And I didn't want to depend on the presentation to explain things to you guys because I just wanted to use it as an aid to show you the images that helps in visualization. But you have been very, very interactive, and I can see, like I mentioned to Matthew in between the session, that I couldn't, wait till the end of the session to tell you guys that. So I think all of you have a very bright future ahead. And if you need help with anything to do with health tech, medicine, healthcare, telemedicine, and like some of you mentioned that you would like to volunteer with DigiSwasthya, I'm more than happy to be there for you guys, be available. Even I am associated with a couple of mentor programs as well. So if you ever want to have a chat about things in healthcare, feel free to ping me. Yeah, that's about it. Thank you so much, Matthew, for having me. And thank you so much to the lovely audience.
Yeah, for sure. It was great having you here. Real quick before we close, if everyone here feels comfortable doing so, just turn on your cameras. We're going to take a quick screenshot just so we have a record of today's event. So would love to see everyone's faces here today. And so yeah, we'll give it a couple more moments.
Yeah, sure. Let's wait for everyone. It's okay, whatever condition you guys are in, just turn on your cams.
Sure. Once again, it's totally your choice, but it's great to see everyone here interacting and feeling lively and all of that. Okay, I think that's pretty much all right. 3, 2, 1, smile. Awesome. Okay, thank you so much. Thank you again, Dr. Roy. So glad to see everyone here. Please refer to the links I have put in the chat box if you're interested in joining on more workshops. We've got 2 more workshops from Futures Inc. Japan, as well as Best Buddies, and then followed up by a discussion session. So if you're interested in joining those, please check out the links. And also feel free to check out our organization's website, learn more about MUN Impact, and follow us on Instagram or check out our link tree. But once again, with that said, thank you for being here. Thank you for interacting and being such engaged participants today. And we hope to see you in a future session soon. Thank you. Have a good one, y'all.
Okay, thank you so much. Bye-bye.
Bye.
Thank you.
Thank you.